She won most talkative in high school, and she has been running her mouth ever since. Welcome to the Lisa Fisher Said podcast with your host, Lisa Fisher.
Okay, not many times I have someone who can speak, is it 6 languages you're fluent in?
5.
5. Oh, okay, well, now I've got to find
Only.
someone who can do 6. Yeah, we talked obviously before we started recording. You have an impressive pedigree and history, and the fact that you have Persian descent, lived in Europe, and now you're in the U.S., you're in Florida, and you're practicing medicine, part of it because of freedoms. And people need to understand that there are certain states that are give a longer leash to medical providers than other states. It's a fact of science. This is not about politics. It's about, I hope this is what I tell my audience and my listeners, and I am a certified health coach, is I don't care what decisions you make for your body, just be informed. So if you choose to take whatever's been offered the last 3 years and take birth control and take ibuprofen, and drink Diet Cokes with the information I've given you, then clearly I'm not as convincing as I thought I was, but have at it, because that's where I hope people are. But what is your passion, though? Because you are a surgeon, a gynecological surgeon. You see women every day. Your life has changed so much from coming from a totalitarian regime to, well, you were in Eastern Europe, weren't you? Where I don't know how many freedoms you had.
Central Europe, you would consider Austria as Central Europe. It wasn't
Okay,
part of the, yeah,
that's
it
true.
wasn't.
That's true. So
Mhm,
that was
yeah.
a democracy, right? Austria was a democracy.
Yeah, they were. And I think they still had obviously reaped the consequences of the Second World War. And
Sure.
they made a lot in the education. You would hear a lot about it and try not to repeat the mistakes. But
Yeah.
yeah, I definitely lived in 2 countries where at some point totalitarian regimes had taken place or were
Yeah,
still
that's
taking
right.
place. Yeah.
And that's what we want to avoid here, of course. But as a provider, what is your passion for women now in 2023, going into 2024? So much has changed just in the last 3 years.
Yes, absolutely. I've always loved hormones and I've always loved women's health ever since I was in high school. But the last 3 years changed a lot of things in addition to that, where my eyes opened up to how important it is that I inform myself about certain
Mhm.
medications or therapies that are new on the market and they're being pushed on really large scale by news medias, even politicians, Hollywood celebrities, that I do my own due diligence and don't just go with what's being said and research and then really do really good job at counseling women. And it's been really easier to do that once I was outside of the big hospital systems where certain protocols are dictated, certain ways to treat women and the way you counsel them and the amount of time you can spend with them. So now my passion is just educating women about their bodies. And I agree with you in everything you said. If you're going to make choices on your diet and your treatments that you do to your body after I have counseled you about of them,
Right.
that's your autonomy,
That's right. That's right.
that's your freedom of choice, and it's absolutely fine. And I come from no place of judgment, but I'm here for you to discuss what the side effects of things are that you might not really hear from your regular OBGYN. And I know what your regular OBGYN says because I trained in that system. So
And
I can
right,
see
that's right.
both of,
So
both sides.
you're no longer bought and paid for. You must have a private practice where you're not in a hospital setting.
Correct, correct. And
Okay.
it's much harder to be outside of the insurance system.
Oh, I
Definitely much more
know.
struggling, because you don't have a lot of people who can pay out of pocket for
I
your
know.
services. But in the same time, those who do, I think they appreciate and they value what they get from you because they know that you have sought out freedom over a certain financial security, and then they also appreciate the kind of knowledge you can share with them because you're not part of a bigger system.
Well, I feel like the elephant in the living room right now is in
Mhm.
some of that conversation. I'm reading between the lines, but part of it might be the Ozempic, semaglutide conversation. Are people are people getting all the information when they go in and say, "I'm desperate to lose weight. I want the shot. Give it to me." Is a provider saying, "No, there's a risk of thyroid cancer, and you'll be on this for the rest of your life"? Are people saying that?
I do. And I love that you brought this up. This is very similar to another injection that people got the last 3 years without maybe being told everything that's associated with it. Um, we just don't have long-term data as much. Every day I hear a new
Yes.
headline about Ozempic, right? Like 2 months ago, you hear higher suicide rates, right? And
Yes.
then a month ago, you hear, but it's also great. Hold on. I mean, it helps with heart failure. So you hear every week a different headline. Don't you want to maybe wait out and see what the long-term studies are? And so I do talk to patients and I say, listen, we don't have completely long-term data. This is what we know so far. It has been associated with these positive and these negative changes, and you make your
Okay.
decision. And I have patients whom I say pancreatic cancer, liver disease, gallbladder
Wow.
issues, thyroid disease, higher depression, suicide rates, blah blah blah, and they still want it. And I'm like, perfect, I'll prescribe it for you because
That's
you
right.
know everything. You know everything now. The same with the birth control. If they want it,
Oh,
after I tell them everything that could be associated with it, I let them make that choice. Same with hormone replacement for menopause. I mean, and I don't want to put hormone replacement and menopause in the same category as birth control or Ozempic, because I do think that the hormones, the type of hormones we use in hormone replacement is different.
that's
But
right.
just
What we're
to
using now.
what we're using now and what we
Yeah.
know about and what's coming out now. But again, long-term data is always superior to short-term, and it's someone's own decision. And I tell people also the duration, the dose makes the poison, right? The dosage. So if it depends on how long you use something, and if you're actually using it to make positive behavioral changes of your eating habits during the time that you're using this medication. If you're using it as a shortcut to being healthy, you're just covering up the underlying issues, right? So yeah.
Yes, but so I have to think about the mechanics involved because
Hmm.
let's go back to metabolism 101. The hypothalamus gets involved, tells the pancreas to release insulin. Insulin's a
Hmm.
fat storing hormone. It takes the glucose, it ushers it to the cells. A few hours after we've eaten, then you have a glucagon. You have glucagon that the pancreas releases that tells you it's a satiety hormone, right? It's like
Yes.
um, leptin or
Hmm.
cholecystokinin that tells you, you know what, you don't need any more food. So, uh, are we producing that on our own then without semaglutide? Yes, right.
Yes.
So
Yes.
the person who battles obesity or has high fasting insulin, we know is insulin resistant, they may not be pushing that out. So this is a band-aid that gets them through a period where glucagon, like you'll hear the GLP-1 agonist. That's
Hmm.
what the
Hmm.
definition of that is. So after they're off the medication, do they then start making glucagon? Uh,
That's what I that's what I'm saying. It all depends on what they do to build that up. Are they doing other things to help their gut flora and their muscle mass
oh,
so that they
okay.
build up more of those receptors so that those, own bodily made substances can work better? We know we can definitely also make it more complicated and talk about how there is genetic and epigenetic changes. But I do
Yes,
think
for
that
sure.
even if you have a genetic predisposition to obesity and maybe you make less of certain substances that are beneficial to maintain a body, body mass that's normal, you can't deny that there's a lot of epigenetic changes due to
Yes.
the habits that you then have, the type of food choices you make, the type of exercise you perform, and how stressed you are and how your cortisol levels are. So if you then arrange and adapt all of that while you're taking this medication, maybe then coming off, you would be better off than you were before. But I just don't know if everybody's doing it in the same way or using it as a shortcut and wanting to avoid those healthy habits that they still have to maintain on a daily basis. And I think there's just, in general, I've noticed whenever we try to take a shortcut in medicine, it just never really works long term. It really,
Fen, hello. I mean,
yeah,
we
yes,
could go through years and years of case studies of people who've been bitten in their
yeah.
skinnier butt with some of these things that they thought would manipulate it. Do you know anyone that weaned off one of the semaglutide
Mhm.
or in that
Mhm.
family and that they are still successful today with weight loss?
It's a great question. Because I've only been using it for a few months, I only know people who are on it. And then some people who couldn't tolerate it came off and then gained weight back.
Right.
So it's a really interesting question. I just don't have enough experience with it. And I do believe there's some differences between the type, like the tirzepatide, I think is better than the semaglutide
Oh,
because
you
it does work
do?
more. Yeah, just because some data coming out how it does affect the gut bacteria in a positive way, in a
Oh,
certain way. But again, do I think that's the only way to do that? No, we know certain gut bacteria that we have, short chain fatty acids, Akkermansia, and I test for that. I can, through food groups, help people to build those bacteria up. So it really depends on how deep someone wants to go. If they want to go really deep, I'll go as deep as vitamins and minerals and
I
help them
agree.
with the receptors. But some people just want a quicker fix because they feel so bad. They just want to feel better about themselves quicker. And they don't have maybe the patience to wait out to see weight changes after 6 or 12 months. Like, for example, by mineral balancing and some of the lifestyle changes I do with women, like sauna, light therapy, things like that,
Yes.
you can experience weight loss. But it takes 4 to 6 months to even see a few pounds. And then if you use the right hormones, or you support the thyroid, or you support the hormones that they're losing in perimenopause and menopause, yes, but it's never going to be overnight. With these weight loss
It is
medications, they see
overnight.
quicker result. And they like that people are so used to, you have to understand, we have had hundreds of years of pharma in our society, and people, even though they now don't want to use ibuprofen or Tylenol, they're used to the quick effects of
Yeah.
medications. And so it is sometimes, as a doctor, I say, hey, I can do this, and it's going to take longer, and it's going to take some hand holding, but we can get you there. I had a patient, high blood pressure. Took me 9 months, even though I optimized her minerals, vitamins on paper, everything was great, but it was her stress. And she couldn't give up the stress, in her daily, life. She couldn't give up certain things that cause a lot of stress. And only until we brought the coach on board and she worked a lot more on that could she get 100% there. Before, with my supplements and the diet and the hormones, 70%. And then the lifestyle, another 30%. So these are the people who are patient and who are in it for the long haul. They give it time, but a lot of people want quick solutions, for
Well, you
sure.
mentioned the coach part.
Hmm.
When I got my coaching certification from the Institute for Integrative Nutrition, New York, uh, Dr. Hyman came and spoke to us, but it was about that time that he was saying that really, if Venus and Serena Williams, the greatest tennis players in the world, still have a coach, why wouldn't other people? He says health coaches, and I'm not saying that to toot my own horn. I'm saying that all of us need someone to partner with, to lock arms with,
Yes.
um, because we know a physician's time is limited. Even your time is limited, and you just need someone sometimes to help you, put me in, coach. What's my game plan? That's just what people want
Yes.
sometimes.
Absolutely.
They want someone who can empathize with them and say, I've been there. And
Yes.
that's why, for a woman my age, I have so much empathy for menopausal women, postmenopausal women, just because during that time, as I was going into perimenopause, and Oprah's now made this meme, or it's really a real famous, and she was 48 years old and she had heart palpitations. And so, of course, they sent her to the cardiologist. They put, she's, had the heart monitor. Yeah, it was menopause, but nobody was addressing it. So let's talk about some of those silent, unusual menopause
Yes.
symptoms for people.
Yes. Hallelujah. Absolutely. Great topic. Palpitations, one of them. AFib increases incrementally just from the lack, the fall of estrogen and
Yes.
the changes in your hormones. And then as your thyroid also changes with those changes. Yes, absolutely. So palpitations, mood swings, and even depressed mood that people didn't have before. So they get put on SSRIs or antidepressants.
And hate for your family. Like, there was a time that my husband's out breath got on my nerves. And I adore him. I've been married to him for 35 years. But I would think, really? You want a grilled cheese sandwich now? Like, anything got on my nerves. Now I'm happy
Yes.
as a clam because I've got an estradiol pellet in my butt. I take testosterone transdermally, and I do progesterone at night. So I'm delightful. But there is a time where you hate your family and no one tells you. It's because your
Yeah.
hormones are imbalanced.
Yes, absolutely. So the mood, obviously, joint pain, where women get started worked up for autoimmune, rheumatoid arthritis, and then
Oh,
they get the stamp
I
of
see that all the
fibromyalgia.
time. Now,
Yeah.
wait, now, isn't this true? My sweet endocrinologist who shepherded me into a life that giving me my
Uh-huh.
life back with, natural thyroid replacement, told me 20 years ago when I first got diagnosed with hypothyroidism and vitiligo and all, I had a positive ANA titer. He
Yeah.
said, because you birthed something. He said, everyone who's birthed something has a positive ANA titer, but they make you run for the hills that you're on fire, that then they were making me think I had rheumatoid arthritis.
Yeah. And
Ugh.
listen, I mean, even if you had 5 autoimmune markers, it's just a reaction to something. It's not a diagnosis. I mean,
Good.
our hormones do modulate our immune system. So as
Yes.
our hormones fall, our immune system changes. So we're more prone to autoimmune diseases in menopause.
Oh, and it's that, and I've said this so many times on my podcast, people are going to roll their eyes. They're like, I've heard you say it. But until somebody explained to me that at the end of my 30s, when I finally got diagnosed with vitiligo and Hashimoto's, they're calling that thyropause now because it ushers you into
Wow.
perimenopause. The thyroid starts to dissipate at the
Hmm.
time everything else, progesterone, as we know, starts to dip. That 3 a.m. wake up is about age 40, where you're going,
Hmm.
what am I awake about?
Yes.
And
Yes.
then it's the same time that everything else happens. So then explain that this is the science that makes me crazy. Is it estrogen dominance or is it really estrogen imbalance? Because don't sometimes women have too much testosterone during this time?
Okay, okay. So great question. Estrogen dominance just means the imbalance to progesterone. So you can have both
Oh,
low,
okay.
but you have
That's right.
progesterone
Yes.
even lower, and it's still
Yes.
estrogen dominating.
Okay.
It's an unfortunate expression, and I use it on my Instagram because people understand it, but it's really not the right description. It's an imbalance.
So estrogen and progesterone really have to have the ratio, but testosterone has to be in the mix somewhere.
Yeah, so testosterone by itself is still the most abundant hormone of all hormones across all your lifetime
Oh,
until the ovaries completely stop producing it. But you still produce about 50% of your testosterone in your adrenals.
but we
But your
don't want to
adrenals,
overwork adrenals either.
correct, correct. And your testosterone is always more abundant than the other hormones. But as your estrogen falls even more, there could be a disproportion. And then that's where you could have proportionately more testosterone than estrogen, right?
Got
And
it.
then you had like, the undesired effects of hair growing on places you don't want and
Yeah,
other things.
cystic
But
acne.
interestingly, it doesn't work on libido or preventing the clitoris from shrinking or the
Oh, it
sensation.
doesn't.
No, because it's still low. Like it's just proportionally higher than
Oh,
because in terms of absolute amounts in the blood,
I see.
that's how I explain it to myself. I mean, I've
Okay.
not gotten it explained by someone, but that's how I see it just based on the absolute values and how they work. But what is interesting is we know too much testosterone not good when someone is in their fertile period where because that causes PCOS and then they get infertility because that's associated with insulin resistance and then they're not ovulating regularly because testosterone can inhibit ovulation but then too little testosterone isn't good either because now you can't build muscle mass and you lose muscle mass and you get fat distribution differently and there's a lot of controversies women can is too much testosterone causes belly fat or too little testosterone and I think it's just about having the right amount. Hmm.
Wow. So it could be either way. Because another thing Mark Hyman says is as men and women age and they approach 60 to 65, they start to look alike. They both have an abdomen, they start losing hair,
Hmm.
and they start getting facial
Yeah,
hair.
the hair growth. Hmm.
So is it because at that point men have too much? Do men make progesterone? Since
Yes,
they
men
do,
have progesterone as
they do.
well.
Okay. But
And
they have
so
estrogen that
yes,
could be out of balance with their testosterone that makes them look that way. And the opposite for women, too much
correct.
testosterone. Oh, right. All right.
Yeah, yes. And I think it's just all about proportions. But then again, you said do you have a testosterone palette or do you have a
I
testosterone?
used to, but it made me have whiskers and cystic
Okay,
acne. So I do the transdermal now, and it's
got it.
much
Okay.
better for me.
Yeah, absolutely. But what I'm saying is, if testosterone was so detrimental to body fat, all these women who get the testosterone pellets where the levels come much higher, they would complain of that, but they actually don't. I mean, this common side effects are the hair growth and the acne
Yeah.
because it makes your pores bigger and it makes your sebaceous glands produce more
Yes, you
sebum.
have oily skin like a
You have
16-year-old.
you have all your
Yeah.
skin, but it, in terms of belly fat, I've never heard, because I work in a GYN office where they do pellets. I've not heard women complain of, I've gained weight on the testosterone. In fact, they have more
Now I
energy.
have.
Mhm.
My
Okay.
provider told me, because my health coaching clients goes to my functional medicine nurse practitioner, and she said she is seeing it, and she's trying to figure it out. Is it lactic acid? Is it something in muscle growth? Is there something that correlates with some women seeing a little bit of weight gain, not a lot, but maybe
I
fluid
think
retention?
Okay. Well, my hypothesis is the aromatase activity. So if you are more inflamed, then you have higher aromatase activity, and you're actually converting it more into the estrogen, and then that could be causing some of those symptoms for
Oh,
women.
whoa, whoa, whoa! So that's where the pathways get involved. The
I I believe so.
estrone, estradiol.
Yes. And as so, I think it could potentially be having to do with underlying inflammation. And so, if you have some, if your terrain isn't absolutely healthy and you put hormones in there, so you put the seed, but your fertilizer isn't good, it's just
Got
not
it.
going to grow a healthy plant. And so, hormones by themselves are not the solution to everything. It again goes back to quick solution. Ideally, I want to work with a woman and know her inflammatory markers, her gut health, her liver function. Is her liver congested? Because any hormone I will push on her, she's going to have a hard time metabolizing if she's not having a healthy functioning liver. And so it's if she has underlying breast inflammation, for example, or if she's underlying insulin resistance, and I give her estrogen, a progesterone, or a testosterone, I'm going to change pathways maybe in a way that don't work for her that well. I have women that progesterone is supposed to be calming, right? And it's
Yes.
activating the GABA receptor. Well, I have women, they get more anxious on it because the underlying reasons why she doesn't feel good to begin
Oh,
with isn't addressed. And so now you're giving progesterone and it's causing the wrong things. So I don't think there's a one way solution for everyone. I think we're all very individual, and hopefully in the future we will even have more precision medicine. But for now, what I can offer a woman is, hey, listen, let me also check your liver, your adrenal function, your gut health. Your breast health, let's do a thermography and see if you have underlying inflammation, things like that. Let's check your thyroid. Let's not just focus on testosterone, progesterone, estrogen. That's where I come from, and I'm still learning. I mean, again, out of residency and fellowship, I've been learning functional medicine. I've done some trainings, but a lot of it comes with the experience that I've gained
sure.
from working with women. So maybe in a few years, I will have even more answers for you.
Oh, good. We'll book you again then, because you have a lot of answers now. So I think the first thing that happens to a woman, because I see women who are my age, and
Mhm.
I'm 100. I say I look good for 100. I'm 60. So women between 40 and 65 are kind of my clients. And these are kind of the symptoms they present with.
Mhm.
Um, their stomach hurts, they have bloating,
Mhm.
they're constipated, they might have diarrhea, which I always, check your thyroid, because sometimes when that was remedied, a lot of that was remedied for me. When that was addressed, a lot of that was remedied for me. But the first thing a Western or traditional provider will say is, well, you need to have an upper and lower GI. And
Mhm.
those
Mhm.
people are so hopeful, and they come out of there with nothing. Because all
Mhm.
that's really checking for is if you have esophagitis or if you have polyps. Well,
Mhm. Mhm.
that's not what causes tummy aches. What causes
Mhm.
tummy aches, constipation, and bloating is poor gut health. So instead of running, and I love me some GI doctors, but I'm just saying, you're going to be sorely disappointed when you come home and there's no answer. So, what's your first thing you do when she comes in and says, or the doctor says, we need to rip out that gallbladder?
Yeah.
Don't do that either. So, what's the first thing you say someone should do if she's noticing bloating, constipation, maybe burping, slow motility, other things? Not run to the GI doctor, but do what? What's your favorite thing?
I mean, ideally, if they want the testing, the gut stool testing, which isn't a functional test, it's not usually covered by insurance. You have different companies. You have GI Effect, GI Map, Gut Zoomer. But even before that, let's say she doesn't even want to spend money on it. I have a
Okay.
few tests that I can have them do, like drink some baking soda and tell me if you're burping, and then I can see if your stomach acidity is affected.
So, do
Um,
we want, because we don't want to drink the water that they say is alkaline or whatever. what do we want do we want acid in our stomach? We do, right?
So the alkaline water doesn't affect our stomach acidity much because our stomach acidity is so low, between 2 to 3, and this alkaline water being at 8, it doesn't really have so much effect of it. Now, if it's all about quantity and how much you do something, but you actually want your stomach acidity to be low so you can digest food.
Okay.
You want it to be low so it can break up the food and digest it before it gets
Okay.
into the small bowel, because the small bowel still has a little bit of acidity, but not too much. It becomes much more alkaline. And then the large bowel is completely alkaline. So by the time food gets there, if it hasn't been broken down, and if your stomach acidity didn't work well, then you have in your stool undigested food, and you change the pH in your gut the wrong way, and then you get more diarrhea, because it all has to do with alkalinity and acidity and how much food digestion has taken place. You start digesting with your saliva, so
That's right.
chewing is really important. Slow breathing is important, so you activate your vagus nerve, so that's rest and digest mode. Instead of running around with a pizza slice, running after the kids with a pizza slice in your mouth, it would be great if you could sit down for a few minutes and
And
really
not look
slowly,
at your phone.
and not look at your phone and
I've heard people
breathe
say that.
things that upset you, and then you get your vagus nerve activity lower.
Oh.
You want to really be resting and enjoying and taking in the food and the smells and how it looks, and then digest it slowly, and then it goes into the stomach, and you want your stomach acidity to be really good. Break it up, and then it goes further. But that would be the first thing to start. How are your eating habits, and what
Mm,
are you eating
that's good.
before I even go to a gut test? Because that's a few couple $100. What if her problem could be solved by just discussing how she's eating? And then so that would be my first thing. But let's say we assume someone has low stomach acidity. Then people say, oh, give them digestive enzymes. Yes, that's great. But again, that's a band aid. Why is her stomach acidity low? Is her nervous system completely in the wrong activation? You need to work on the vagus nerve activation and coming down from the sympathetic overactivation. You need to address nutrients you need to make stomach acid. Did you know that, Lisa? You need, for example, you need B12, and you need certain minerals to make stomach acidity. So
Now,
if it imbalances,
what if at
yeah.
that point you have the MTHFR gene?
Mhm.
Does that compromise your B12? Does that have to be methylated?
It can, but if you're eating enough foods with methyl donors, or if you have enough, if you have the right balance of sulfur-containing foods and it's there's so many complicated details to that. You can have MTHFR and have wonderful B vitamin levels,
Okay, good,
folate and B12.
good.
It really depends on the context. So I always say MTHFR is the genetics, but
Mhm.
your epigenetics make really the difference. And so we can work on first figuring out where you're at, then work towards getting you towards where you want to be. But yeah, I think an important thing is to say, I don't just say, hey, your stomach acid is low, but also let's work on, is it parasites? Is it stress? Is it low nutrient levels that make your stomach acid low?
Okay,
All those things.
there are so many
Mhm.
things. I have so many questions from this. Let's go back to the baking soda test. What do you think is a benign thing anyone listening right now can do just to see where their baseline is with stomach acid?
I think super easy is to say, hey, do you tolerate meat? Like, does eat sit in your stomach for a long time?
How do you know? I've heard people say I'm more
You
carnivore, and
you
people say I
become
can't do that. Meat stays in my stomach. I'm like, I don't know if meat's in my stomach.
how do you know? You become more averse to it. You start not liking meat anymore. It's because you actually
Oh,
don't digest it well, and you don't feel
okay.
good on it. You
All
don't
right.
feel good on it. It's like me, I don't do well with the bread here in this country, and so I automatically stay away from it.
Good.
I don't have celiacs, but I'm not gluten allergic, but I have gluten intolerance, so
Yeah.
yeah.
Well,
Yeah.
wouldn't you say everybody in the U.S., because of the way our wheat is grown and manipulated, and because is that my phone or your phone? Is
No,
that me?
it's mine, and it's
Oh, sorry.
actually the computer,
Oh,
and
in
so I
your
can't
computer.
turn that part off. So
Yeah,
sorry about that.
that's okay. But with that, um, eh, because you lived in Europe, you probably weren't bothered by the baguette bread you got at your favorite Austrian cafe, but you are when you're
Yeah.
at Disney World picking up
Yes.
a brioche bun, right?
Can we talk about how the food in Disney is like the worst food ever for these kids? My goodness.
Oh, yeah, I would love to. Let's talk about it because I haven't been in
Why?
years, but it's
Oh.
it's all just processed crap, right?
When you go to Disneyland in Paris, the food is much better than Disney World. I mean, it's just much better. But
Really?
yeah, but overall, I'm not a fast food person. I grew up with, so I don't know if you know that, but if you grew up as a child and you are exposed to a lot of spices, your palate develops around the age of 6 or 7, and so you're more
Yes.
prone to liking whole foods less than fast food. I wasn't exposed to fast food as a child, and I thought that was really great
That's
because to this day,
amazing. So
yeah,
it
to this
is
day, I
age
don't like it.
6.
Yes, to this day,
Um,
I
I,
don't like it.
I
Hmm.
remember we had neighbors who were from India, and that's my
Hmm.
favorite cuisine, and I love it as an adult. And I remember they brought us over sag paneer and some other things, which are, oh my gosh, my favorites. And when my kids, when they were little, they didn't like them. And I go, then how do their kids like it? Our kids were about the same age. And it was probably just the turmeric they smelled all the time and the cumin and the garlic. And they're, they probably just through osmosis, enjoyed it. Now, as my kids are adults, they love Indian food. But I always wondered how to get younger children in the US with a sad diet, standard American diet, which mine really didn't have, but they still had more Western foods, how to get them acclimated to it. So we should have them eat it by age 6. They should start developing some taste for it, right?
Yeah, your taste buds develop mostly as a child. So if they're more exposed to different tastes and spices and herbs, they're going to be more prone to making healthier choices as an adult.
That's very interesting. Okay, so yeah, the food at Disney World, the food everywhere. If you're
And and to get you back to your question, it's the hybridization of wheat that causes these
oh,
intolerances.
got it.
And then we sprayed with glyphosate.
Then the glyphosate. So that's why I've stayed off it since March 1st, trying to calm down my immune system.
Mhm.
Just as I don't have a celiac,
Yeah,
I have a glyphosate sensitivity, as we all
correct.
do. Right.
And
That's the
and and
test.
Lisa, I love checking for environmental toxins. For those who are really, really sick, I need to do more tests than just hormones. And when I check for mold and Lyme and environmental toxins, you would be surprised how many people have really high glyphosate levels. Obviously,
Oh,
they
you
also
can
are,
test for it.
you can test for it in the urine.
Does a Dutch test do that?
I do the Mosaic labs. I
Okay,
like them.
Mosaic
And
labs.
then you can
Okay.
use Vibrant Wellness as well. So I think Mosaic is going to come out with their glyphosate add-on, and then Vibrant does it currently. But I like Mosaic for my mold testing. So and they have other things in their environmental toxins, like I check for plastics and
Oh,
heavy metals. Yeah, it's really great. You can test for a lot of things. The question is, who is going to interpret it for you, and
I
how they're
know.
going to help you, um, you know, deal with it. Because we don't want to just do testing and create more anxiety. We want to have
Exactly.
tools to help you overcome your health struggles and not just diagnose you with things and then leave you with that. So,
Well, since you are across state lines in Arkansas, can you can interpret those results, and you don't have to be in my state for that, right?
yeah, I can interpret things. I can be completely your second opinion consultant. I can be your health consultant, but I
Okay.
can't be your physician and prescribe you medications
That's
for
fine.
it.
Well, we all want to get off the medications.
Yes, but it's just important to say, like, some women do want hormones from me, but across state lines I don't do hormones, but I do absolutely help them and say these are the things you need to check. And sometimes they just want supplements, sometimes they want functional testing, so they don't always want hormones. And that's another thing. I love treating menopause, but not everybody wants to be on hormones, even though they might have a lot of benefits for them, and that's also great. And as a physician, you should have tools to help women that want to feel better without hormones too. You should, because everybody
Right,
should
but
get to choose.
again, when I feel like when women are informed, and I say
Mhm.
things because it benefits me zero financially if they're on hormones. I
Yes,
just don't want to see their
correct.
husbands pushing them in a nursing home, pulling the hair out of their chin someday. And I say that it's cardio protective and
Yes,
it's dementia protective.
correct.
That to me would make everybody go, not a bad idea then. I might want to do this.
And one of the biggest, if someone, let's say someone makes it past menopause, and obviously a majority of women do, I worded that wrong, but let's say you are past menopause and now you're worried about what's going to kill you. It's primarily cardiovascular disease, right? And then much lower than breast cancer. Let's say you didn't get any of that, but now you're 75, 80, and you didn't do balance training and your muscles have shrunk and you fall. Now you have a fracture, which is one of the highest risk of death for women, at a certain age. And hormones do help with bone health. I just had a woman, I had a patient, only 55 years old, but we helped improve her DEXA score and bone density so much more with the hormones that I was giving her.
Okay, when is it too late then for a woman to start taking hormones postmenopausally? I see sometimes a 10-year window. Is that it?
Yeah, I do think that's actually a more arbitrary window. I
Okay,
think the NAMS society and the ACOG and all these official societies, they say they have a lot of data, but I have never really seen convincing data that says you can't start it beyond that 10-year window.
good.
You just have to understand that if you start it earlier you get more benefits, right? And one of the things is because estrogen can be beneficial for cardiovascular risk and also decrease your plaque buildup. If you wait for more than 10 years, you might have had some plaque buildup, especially if you have underlying inflammation and certain cholesterol markers that are elevated, and fatty liver and insulin resistance. Now you have higher risk for plaques. So it is true that if you start beyond the 10-year mark, you are catching up and you might already have built some plaques.
Got
And
it.
now the concern is if you now start estrogen, that you could actually make those plaques more unstable, and that could lead to an event. Here's my response to that. We have screening methods for plaques. We have screening methods of seeing if you have higher risk. I can check your insulin resistance. I can check your lipid markers. I can check a coronary artery scan. I can check for plaque buildup, and then I can say, hey, you're safe. And I look at your family history and your personal
Got it.
history and your symptoms. Do you have angina? Do you get short of breath? Like, I have you get a cardiology workup, and now you're good. I don't think there has to be a limited, time frame if you are symptomatic and you want to benefit from it.
I think that's very encouraging because I've just recently seen the 10-year mark with that, or a 10-year window for
Hmm.
someone. And because I'm 60, I'm kind of getting close to that, of my peers. I've been on it for a long time, but for my peers who I talked to, I was thinking, oh, shoot, you may have missed the boat. I'm glad that the boat's still out there. They just may have to do some
Yes,
things. They might have to take a dinghy to get to the boat because they
yes.
might need to find some things out. The calcium score is a tremendous screening opportunity. We have it here at our Arkansas Heart Hospital for $99. And
Wow.
yeah, it's
Oh,
it,
that's
it's
great.
it's called Keep the Beat. It looks at carotid artery,
Awesome.
and it's measuring some other things. Of course, I understand that it's almost they're trying to upsell you because they hope, not that they hope something's wrong, but they do have a heart hospital next door in the event you have one of these conditions. And which is great that they want to fulfill their mission of I hope their mission is to reduce heart disease. But I also want to know, when are we going to stop considering cholesterol as a cardiovascular risk and start looking at insulin resistance and fasting insulin and high sensitivity C-reactive protein and other things? And even thyroid patients have a higher risk for
Correct.
cardiovascular issues. No one ever
Correct.
addresses that. The fat
Correct.
girl on the treadmill, really, if she would just, someone would treat her thyroid, she might lose the weight and reduce her risk of cardiovascular disease. How do you address that?
Absolutely. Every PCOS patient, for example, every
Yes.
weight patient of mine gets thyroid
Yes.
check. Literally everyone
Yes.
gets thyroid check because I do a
Yes.
full thyroid panel, not just the TSH and the free T4. I do a full thyroid panel. Let me say something about the plaque. So officially, I can't say we cure anything, but in a functional medicine practice that I have, I can even help women with plaque buildup without a catheter or angio.
Oh, really?
Yes, yes. Um, so there is IVs and there is supplements that
Okay.
and lifestyle changes that can be done. In terms of cholesterol, it is not completely useless. It's the oxidized cholesterol LDL and the LDL particle size and number that
So
has an
particle
issue.
size
And
and
number
and
and the
is that the
oxidized.
APO?
That's the carrier. That's a carrier molecule for that
Okay.
cholesterol molecule. So if that's elevated, that can also be modified. We have some data that certain supplements can help modify that even, and I work with, I am in a network of people where we just are in a WhatsApp group and we exchange ideas. So I know a lot of functionally trained cardiologists. So if a woman was
Yes.
interested in doing things naturally, I could refer them to them and say, let's get your heart naturally treated
Right.
and your AFib, because we know magnesium taurate and potassium and just can help with AFib, right? Get that treated. Let's get your thyroid treated. Let's get all the underlying viruses and let's do the hormones. So I agree with you. I think the future is going to be teamwork, a
Yeah.
team of experts all thinking alike,
Yeah.
and having great health coaches on board in that team, right? So that's going to be the best success.
Well, I had a client reach out to me because she's a former professional women's golfer, and I mean, very, very fit. Her husband's very, very fit, and someone told him his cholesterol was high. And, of course, I just went womp womp womp. But she said, well, he was going to never eat steak again. I said, well, please, this is my text message. Please don't make that rash decision. Your liver makes cholesterol. I'm an intermittent faster, so I might have higher cholesterol because I fast so much of my day because that works for me. But she's ordered DHEA, red rice, omegas, and flax and chia. Are those things that modify or mitigate the scary cholesterol or no?
Okay, so what she did is she did chia and flax because those are the plant derived omegas. And then she's
Okay.
doing omega 3 supplements, which is the fish derived. So she
Yes.
has the EPA and the DHA and that covered. And there is data showing that omega 3s being higher is beneficial for your cholesterol profile. Then she did the red rice yeast, which apparently works like statins, but without being a statin, so it can lower your cholesterol. But my concern is we don't have long-term data on the use of that supplement either, right?
Okay.
And we don't know if that affects your coenzyme Q10. And I'm sure there's some PhD biohacker out there that knows about those
Right.
things, and good for them. But what I'm
Right.
saying is, any supplement you do doesn't replace looking into the details of what is his fat metabolism on a cellular level. These are the things I do. I check for. I do a testing called the Nutrival, and I look at exactly what his cells do to convert energy. And they're ignoring his thyroid and they're ignoring his
Uh,
testosterone levels, because we know
okay.
testosterone is important for your lipid profile. If he's
Yeah. Oh,
older,
for sure.
now his testosterone is lower. Maybe that's part of the reason. And I don't know how many beers he's drinking at night, and I don't
Right.
know what exactly his macronutrient profile looks
Sure.
like. So there's so many levels. Go and get a supplement, but please don't forget all the other things you need to look
Okay.
into to get the best benefit out of it. But in terms of what she's doing for him, yes, this is how I would explain those supplements. But that's not even everything. I was talking about how we can help reverse plaque. There's certain supplements we can definitely even help with mild plaque workup. There's certain medications that are repurposed, like low dose colchicine, or like certain low dose medications nobody has even heard about that can affect plaque buildup. There is certain peptides you can use, stem cells, but not in a way where you inject them, because you're not allowed to in the US, but you can use like patches and oral there's so much one can do. But again, you cannot forget the basics. How is this person sleeping? How is he
Yes.
eating? What's his stress level? What is he do? How much natural light is he getting?
Yes.
How much exercise is he doing? So yes, there's 1,000 things out there. So many people are confused because there's literally a supplement for a supplement of a supplement.
That's
But
true.
So true, isn't it?
Yeah.
But you need to understand that you can't always solve everything. Sometimes you need an expert like me that actually
Yes.
helps interpret the data and helps you even tell you the downsides of a supplement. Like, did you know that now everybody wants to be on turmeric? Did you know
Yes.
turmeric can actually impact absorption of other nutrients in your bowel?
Oh, it would compromise it and
It could potentially, because
oh,
obviously it's a big molecule that can have downstream effects. So while it can help improve your natural killer cells fight off cancer and bring down inflammation, it can also inhibit iron absorption. So if someone is iron deficient, you can make it
oh,
worse. So
wow.
you do need people who understand all these intricacies. You can't always find all the answers. Just like I can maybe read a certain law online, but I don't understand how to interpret it. I'll need a lawyer or an
Yeah,
accountant
sure.
for my
That's a
taxes.
great way to put that.
Yeah.
Well, I'm sending them to you then because she's also a life coach and helps a lot of people. So she loves the online world. It would be perfect. How can people get in touch with you? I'll put your information in the show notes, but would they just go through your office then? Because
Yeah,
if
they
if
can.
they're
Mhm.
outside of the state of Florida, not looking for medical help, but looking
Yeah.
for more of the big picture screening for these other things, they can just reach out.
Yeah, they can find me on Instagram and they message me there, and it's Dr. Salome Masghati, MD. And I usually check it on a daily. And then my email is drsalmasgati@gmail.com. So
Okay.
those are the two ways. Hmm.
All right, we'll put that in the show notes so we can help people because we have to wrap up now. But wait, back to the baking soda. Do you do baking soda? You drink it and then you're seeing, do you want to burp or you don't want to burp?
So if you birth too quickly, then your stomach acid was really low.
Oh,
If your stomach acid is high, good enough, and people can Google that, just the right
okay.
amount and everything.
Yeah.
It's
Okay.
super easy. But there's also ways to, when I do the gut health testing, I actually look. That's a little bit more detailed. Then I can actually see how you're breaking down the foods, because it looks at the fat content in your stool that you send in, and it
Yeah.
also looks at your pancreatic enzyme function. And so it does give you a little bit more information if you want to go through the gut health testing. Hmm.
All right. So you
Hmm.
think gut health testing is important? Hormone testing obviously is important. Are
I
these
love I love nutritional testing on a cellular level.
okay?
Like someone might have MTHFR and be taking folate and like methylated folate, but then they can cause an overmethylation in their system, from
Uh,
undermethylation to overmethylation, and not feel very good and then get more anxious. And you don't know until you look at, on a cellular level, what are their nutrient deficiencies. And you don't check that in the blood. You sometimes need plasma markers, urine markers. So you do need to do the right testing for the right person.
all right. You're a one-stop shop. You can really do it all.
I mean, I love to know everything, but there will be so many people who are better in, like, experts in certain areas, and then I like to refer out. But if a woman comes to me, I pretty much can talk to her about everything and then say, hey, but to get this type of help, let's maybe bring this or this person on board. Yes.
Well,
Because
your social
to be
media is
honest,
great too.
because I don't think our bodies read textbooks, and our bodies
No.
don't get to say, oh, it's just my vagina, that's having an
Mhm.
issue. It's always the whole body. So the more I learn about everything, the more I can help women, at least direct them for help to certain specialists. At least they can find some answers with me. Yeah.
I use a similar analogy to my health coaching clients in talking about
Hmm.
fasting. They say, well, I'm drinking a Diet Coke in the morning. And I say, well, your body doesn't read labels. It thinks food's incoming, and your pancreas releases insulin to usher glucose to the cells. So I say it the same way, just I dumb it
I
down
like
just a
that.
little bit for fasting, just
I'm
because
going to borrow
people
that.
have to have visuals sometimes to
Yes.
under or I do.
Yes.
I'm a visual learner, so I understand it when that's why I can understand the way the pancreas releases the insulin, and we hope it takes the glucose, takes it to the cells. If it doesn't, then insulin circulating, and then it's
Hmm.
not good for you. So I'm very
No.
visual. I love the way you said that. You're a delightful guest. You're, like I said, your social media is great. Um, I just like the way you operate. I like
Thank
I
you
like
so
your
much.
whole philosophy, and you're just
Oh,
a beautiful soul with, again,
thank you.
5 languages fluent, has lived many places on the globe, and you're in Florida now. And
Yes.
Floridians are lucky because they can see you as a healthcare provider, but we can see you just as someone who can take care of some other things.
Thank you for having me on. It was a pleasure. I love your podcast. So.
Thank you. Thank you. Great job today.
Thanks for listening to the Lisa Fischer Said podcast. Be sure to hit subscribe and download all the episodes and leave a review, won't you? The Lisa Fischer Said podcast is produced by ClantonCreative.com.